Hello, my name is Chaya Charles, and I'm a registered dietitian nutritionist working in the Syracuse area. I have been working with the aging population for about 12 years now and have my certification in gerontological nutrition. Today, we are going to be talking about gut health and the brain health connection. So when we think about the connection between our digestive system and our brain, you have to think about the GI tract being very sensitive to emotion. And so think of that whenever you feel nervous or feel scared, you feel that immediately in your stomach. And so without any scientific studies telling us that, we can feel it every day, whenever we are sad, whenever we're afraid of something. So just thinking about food actually begins to release some digestive juices within our digestive system. So it's one of the reasons that when you see commercials on television, you immediately think, oh, I would really like to have that. Just looking at that makes your digestive system start to produce some enzymes that are getting you prepared for digestion. So the connection runs both ways between your digestive system and your brain, and then back from your brain to your digestive system. Therefore, someone's stomach or intestinal distress can either be the cause or the product of anxiety, stress, or even depression. And we'll talk a bit more about this as we go on in slides, but I think a lot of times people think of, say, a nervous stomach, and they think, oh, well, she's a nervous person, and therefore that makes her stomach upset. What I'm challenging you to think of today is, are your psychological symptoms that you may feel actually related to an issue with your digestive system rather than the other way around? So GI symptoms are not in your head. So if you have what I referred to a moment ago as a nervous stomach, that does not mean that it's in your head. It does not mean that you just kind of don't overall feel well because you're anxious. There are psychosocial factors that influence the actual physiology of your gut as well as your symptoms. So stress or depression or other psychological factors can affect the movement and contractions of your GI tract. So that's sometimes why if you're very nervous, you may have to run to the restroom very quickly because the actual movement of your digestive system is being impacted by the stress that your overall system is feeling. This can also lead to chronic inflammation being worse, or perhaps even make you more susceptible to infection, which we'll talk about that again in a moment. Also, there are studies out there that show that people with functional gastrointestinal disorders may actually perceive pain more. So even pain receptors may be more sensitive if you have this kind of dysbiosis or imbalance going on. Stress can then make the pain seem even worse. So when we're talking about pain, it is a very cyclical thing that is happening. Someone feels pain, the pain causes stress, the stress causes GI symptoms. Those therefore worsen the feelings of pain, and the cycle goes on and on. So psychological factors can absolutely influence physical symptoms that you may be having outside of your digestive system. Studies show that in some people, a combination therapy often works best. So someone who may have irritable bowel syndrome or something along those lines, kind of a chronic GI disease, they likely would be taking a medication for the GI symptoms. However, a combination of that medication with some type of psychological medication may actually prove effective. And there's a few studies showing this. I've actually seen this in patients myself firsthand. I've had a few patients who start taking just a very, very, very low dose of an antidepressant in combination with other digestive medications and seeing a pretty significant improvement in their overall digestive symptoms. So your stomach affects your mood. So we have something called the enteric nervous system, and so this might be referred to sometimes as the little brain. So this is talking about stomach and mood outside of just, what someone might perceive to be like being hangry, right? That your mood is poor because you're very hungry and you need to eat, and it's therefore impacting your mood. We're going beyond that type of just immediate type of mood. We're talking about more long-term psychological patterns, so depression, chronic anxiety, those things. So the enteric nervous system, sometimes referred to as your little brain, actually sends signals to your central nervous system. So the enteric nervous system is two thin layers of more than 100 million nerve cells that you have along the lining of your GI tract, all the way from your esophagus to your rectum. So this controls digestion from swallowing to breakdown and the absorption of food. So the entire path that food takes through your digestive system is controlled through your enteric nervous system. This nervous system then sends signals to your central nervous system, and that impacts your mood. So the enteric nervous system may trigger big emotional shifts experienced by people who may be suffering from irritable bowel syndrome or even functional digestive issues such as constipation, diarrhea, bloating, kind of chronic stomach pain or stomach upset. So your mental state, as I said before, I'm challenging you to think of your mental state as perhaps a symptom rather than a trigger. So your stomach is not upset because you are stressed. You may be feeling more anxiety because of an issue with your stomach. And so, as I said, potentially using antidepressants as a method of therapy for some chronic digestive issues might actually seem to be effective. So instead of anxiety and depression making your GI symptoms worse, they may actually be a symptom of worsening GI function. So digestive system activity may also impact cognition. There are some studies that show that as well in terms of short-term memory, ability to do things like crossword puzzles and that kind of more like direct cognitive type task. There are some studies showing that digestive system issues may be impacting that also. And we've seen that in some studies in people that have Alzheimer's disease. So studies do show that it may be possible to treat anxiety symptoms by regulation of your intestinal microbiota. So we're going to get into that in just another minute. So let's look at the gut in general. So when we say the gut, we are referring to the entire digestive system, but most specifically the stomach and the intestines. Our intestines cover more than 4,000 square feet of surface area. So when you break that down to the cellular level, you are talking about millions and millions and millions of cells and the ability for things to go wrong. We have over 5,000 species of bacteria naturally in our digestive system, and these are both good and bad versions. So it's the combination that gives us good GI health. We need both. We need some good bacteria, some bad bacteria. And so we have over 5,000 species in a healthy gut. This balance, though, that you need to keep is impacted by lots of different conditions. So medical conditions such as chronic inflammation, as well as medications that you may be taking that impact your GI system, chronic inflammation. Antibiotic use is a big one. So an antibiotic's goal is to kill bacteria. Unfortunately, it does not discriminate between good and bad bacteria. So when you take a heavy antibiotic, you in essence are wiping out all the bacteria from your digestive system. That includes the good bacteria that we really need for our GI system to function properly. Also, other environmental factors such as smoking plays a large role in the balance of bacteria. Pollution that we may be coming in contact with depending on where you worked or where you have worked previously in your life. Our water, where you're getting water from, if you're on well water versus city water, all different waters have different levels of bacteria naturally in them. And so what your body is chronically used to in terms of bacteria certainly impacts what would be your normal bacteria environment. When the gut is working properly, it actually forms a tight barrier that controls what nutrients get absorbed and what get passed through. So there are certain nutrients we want to pass through the lining to be able to be absorbed into our bloodstream for nutrient and energy use. And then there's other things that we want to pass through. So toxins or pesticides or anything like that that might be in our food, we do not want to absorb those. So in a good GI system, we will excrete the toxins as much as possible and absorb the healthy nutrients. If you, however, have an unhealthy gut lining, that may have what we would call large cracks, and I'll show you an example of that in a second. There may actually be tiny little microscopic holes in it, and what that does is it allows for partially digested food or some of those toxins or some parasites or bugs, bacteria, to actually get through the digestive wall and penetrate the tissues beneath it, and that is not what we want. If that's chronically going on, we refer to that as leaky gut, and we'll talk more about that in a moment. But essentially what that term means is that things are being absorbed through your digestive system that we really don't want to have being absorbed. If that happens, what occurs after is it triggers inflammation, and it actually changes the environment of the bacteria within your gut. So the normal bacteria that we would want in there, the regulation of that becomes impacted. So that could lead to problems not only with your digestive tract, but also with other tissues and muscles and organs throughout your body. So as I mentioned a moment ago, there is something called the leaky gut. And so there is some amount of penetration that needs to be allowed in order for us to absorb nutrients the way that we should be. But if things are getting through our digestive system and penetrating that lining that shouldn't be, that's when we're talking about something called leaky gut. So if that's happening in excess, it can be associated with a lot of autoimmune diseases. We see this commonly in people who have lupus, type 1 diabetes, multiple sclerosis, chronic fatigue syndrome. There are studies that have shown high levels in people with fibromyalgia, arthritis, allergies, asthma, acne, even some mental illnesses, all have been shown to have an imbalance in their digestive environment. So all of these chronic health issues that we think of a lot, in addition to your normal digestive issues that you hear about, celiac disease, Crohn's disease, irritable bowel syndrome, those are certainly all impacted by somebody's digestive function not working properly. But the other autoimmune diseases, people don't often link back to your GI health, and they absolutely can be. So this imbalance creates a chronic state of inflammation. This is also believed to be linked with Alzheimer's disease, as I said. So as the gut becomes more permeable, meaning that more and more things are getting through it that shouldn't be, the disturbance increases the incidence of all of these neurodegenerative disorders that we're going to be speaking about: multiple sclerosis, Alzheimer's disease, and Parkinson's. So if we believe that an imbalance in the digestive system can be contributing maybe not only to the development of a disease, but certainly to the worsening and progression of it, then one would assume that there are dietary interventions we could do to help in treatment and symptom reduction. So a healthy gut versus a leaky gut. This is simply a graphic to show you the difference. So on the left-hand side, you can see with the healthy gut that we have these tight junctions in between the cells. And so nutrients can get into the cells, but it is regulated. And so the nutrients that go in the cells then pass through into your bloodstream as they are supposed to. So the picture on the left is what should be happening. The example on the right is what's happening in a leaky gut. So you can see there's spaces in between these cells. And so things are getting in between these cells that should not be getting in between these cells. Different pathogens, different toxins, and things are getting actually into the bloodstream and being carried throughout the rest of the body that should never have been allowed to get there. So when we look at gut health, specifically in people who have Parkinson's disease, what we see in studies is that this imbalance in the GI health and of the overall bacterial environment leads to a buildup of proteins in the digestive tract. This buildup is then linked to a decrease in cognitive function as well as motor deficits that we see in people with Parkinson's disease. Most of the studies related to this phenomenon are animal studies, and there's more and more human studies being done and coming out all the time. One of the recent studies on animals was done at Johns Hopkins University, and in this study, they took mice and injected excess protein into the gut of the mice. The proteins then accumulated in the digestive system and were traveled to the vagus nerve. The vagus nerve then spread those extra proteins to the brain, and it led to symptoms similar to what we see in humans that have Parkinson's disease. When they cut the vagus nerve in these mice, the spreading of the excess proteins to the brain stopped, and those who had that nerve cut then reverted to the same function as those who did not have the buildup of proteins initially. And so what this shows is that if we can stop the buildup of the proteins from being spread to the brain, we may be able to see a decrease in the motor deficits that we're seeing in people who have Parkinson's disease. So although this hasn't been proven effectively and repeatedly yet in human trials, it certainly is hopeful in showing that there may be dietary interventions, especially some that involve protein accumulation, in treatment of people with Parkinson's disease. Some of these studies are based on the Brack's hypothesis. And so this hypothesis stated that sporadic Parkinson's disease with motor deficit is caused by a pathogen that may enter the body through the nasal cavity and subsequently is swallowed, reaching the gut and initiating the Lewy pathology in the nose and digestive tract. So in other words, that a bacteria is entering the system through the GI tract, then spreading to the brain and potentially leading to the onset and development and worsening of Parkinson's disease. So this hypothesis is controversial. Human autopsy evidence of people who have Parkinson's disease hasn't necessarily always supported this, but there are some follow-up studies that have been done that showed similar results and at least shows that this hypothesis may be along the line of the reality of what potentially is causing the development of Parkinson's in some people. So what can we do from a nutritional perspective to potentially help with this issue? There's a few different things. So one is the 5R restoration program. And so in this 5R restoration program, we are taking remove, replace, reinoculate, repair, and rebalance. So in the first step of remove is removing stressors to the digestive system. So this is getting rid of things that are negatively impacting that environment within the GI tract. So this might be removing foods from the diet that someone might be allergic to or that someone maybe have a sensitivity to. It also could be the removal of parasites or bad bacteria or bugs that are causing issues within the GI tract. So you might use something called an elimination diet, which we'll get to in a minute, to help identify the foods that maybe are causing these sensitivities. Or it may be a medication intervention to actually remove and kill the parasite or the bad bacteria that might be impacting the GI tract. So that's the remove phase. In the replace phase, we would be replacing digestive secretions. And so this would be adding back things like digestive enzymes or hydrochloric acid or other things that might be in lower than desired amounts in the digestive tract currently. So all those enzymes and hydrochloric acid and some other things can be impacted by diet, but also by medications that people may take, especially if someone takes something for like reflux, some type of antacid, that can kind of chronically lower the production of hydrochloric acid within our digestive system. And we need a certain level of hydrochloric acid in order for our system to function properly. So in the replace phase of the 5R program, we may have to be replacing some of those things that may be in too low amounts. In the reinoculate phase, step 3, this is when we help beneficial bacteria flourish. And so this is usually with the introduction of probiotic foods or supplements that contain the so-called good bacteria to help reintroduce those into your system in the desired amounts. Now, probiotics in the form of supplements is controversial. This really should be done under the guise of a doctor and a dietitian to help you determine what the correct combination of probiotics is for you. Not all people require the same reinoculation of the same bacteria. And so it's not as simple as going to the store and saying, oh, okay, I'll pick up this probiotic and then my digestive system will be good. That's not how it works, and that's why you do see people having varying results when they start taking probiotics. Some people might have a great improvement in digestive system issues, but that might mean that that happened to be the type of bacteria that they were lacking. Someone else could take the same exact supplement from the store and not have the same impact because that may not be the bacteria that they are lacking. And so going to the store and simply buying an over-the-counter probiotic is not usually as helpful as increasing probiotic intake through diet, which we can do by increasing our intake of fermented foods, and some yogurts, things like that. Those natural probiotics come in a way that is more beneficial to our digestive system, typically than in pill form. Step 4 is the repair phase. And in this, we're going to help the lining of the GI tract actually repair itself by supplementing with key nutrients that we see in repairing of tissues. So vitamins A, C, E, fish oil, and the amino acid glutamine may all be recommended, or some combination of those recommended depending on the person. Zinc is also another one. And so it would be to actually repair the lining of the GI tract so that we don't continue to have that leaky gut situation. And then 5, the last phase of this program, is rebalance. So this is paying attention to overall lifestyle choices that can impact the GI tract. So sleep, exercise, overall stress, all of those things can over time lead to deterioration of the GI system as well. And so rebalancing means rebalancing your whole life to promote a good GI health. So if you are working with, especially a dietitian who works in integrative and functional nutrition, this 5R program is very similar to something that they might use with you if they feel that you are someone with leaky gut. One of the elimination diets that is popular that I wanted to point out is a low FODMAP diet. Now, this sometimes is promoted as a weight loss technique or something that people should be following in general just to have good nutritional health. I would advise you not to do so. This diet is specifically intended to be an elimination diet, meaning that it is eliminating a large amount of foods to try to figure out specific sensitivities. Now, that is not necessary for everyone in the general population, and it really shouldn't be done unless it's under the guidance of a dietitian, because you can become nutrient deficient pretty quickly from eliminating too much from your diet. In this diet, if we feel that there's someone who has leaky gut and is having severe GI issues, we might trial something called this low FODMAP diet, which essentially what this is, FODMAP stands for fermentable oligomonosaccharides and polyols. So these include things like fructose, lactose, different sugar alcohols. All of those would be eliminated from the diet. This diet was originally developed in Australia, and it's intended as a medical intervention, not a chronic diet for someone to be following. In my practice, I've had people follow this for up to 3 months until we can try to figure out exactly what things they seem to be sensitive to, and then slowly reintroducing the foods that they don't seem to be sensitive to. This whole process takes anywhere from 6 months to a year, typically, to completely remove all the way to repairing the GI system. But if it's done well and under the guise of a physician, and then what we can see is that people over time can begin to tolerate foods that maybe they weren't able to tolerate when their system was so inflamed. We also see symptom improvement in some people in some issues outside of the GI tract, so neurological function, maybe motor function, certainly issues related to skin, dermatitis, eczema. All of those can be impacted by the GI tract, and so replacing with what we need in our system, removing the things we don't want in our system, and overall repairing the health can really be helpful in all of those areas. There are non-probiotic interventions as well, I should mention, that in many cases have been proven to be more effective than probiotic interventions. There's multiple studies that show that, especially in terms of mood state benefits. So as I said before, probiotic supplementation is something that really should not be done on your own. You really should seek a healthcare practitioner to help you with that. Some other potential dietary interventions that you might see out there and that recent studies are talking about. One is the Mediterranean diet, or it might be referred to as a low inflammatory diet. So there are studies, one that came out specifically last year, that looked at the critical role of the microbiome in Parkinson's disease, and specifically looked at people following a Mediterranean style type diet. So in this study, as well as some others, they showed that following a Mediterranean diet was associated with lower probability of developing Parkinson's disease, and that specific components of the Mediterranean diet are particularly associated with these beneficial effects. So things like fresh fruits and vegetables, nuts, seeds, non-fried fish, olive oil, coconut oil, fresh herbs and spices, wine, specifically red wine, as well as flavonoid, antioxidant-rich foods, things like tea, berries, apples, oranges, orange juice, in combination with a high intake of polyunsaturated omega-3 fatty acids. All of those things were associated highly with lower probability of developing Parkinson's disease. Also, when we look at the Mediterranean diet, we consider fiber intake, as digestive issues such as constipation are very frequent in those with Parkinson's disease. Fiber intake is crucial to help control and regulate some of those problems. Hydration is one of the main ways to help control and prevent, to treat and prevent constipation. However, dietary fiber is also extremely important in that. The typical Western diet, so American diet, consumes 10-ish, some people less than 10 grams, up to 15 grams of dietary fiber a day. The recommendation, however, is for 30. And so the Mediterranean diet, if followed well on a consistent basis, typically provides people with 25 to 30 grams a day. So the Mediterranean diet is meeting those dietary fiber guidelines, whereas the typical American diet is not. There are also some studies looking at the ketogenic or fasting type diets in treatment of people with Parkinson's disease. Now, ketogenic diets have long been used to help treat some neurological disorders such as epilepsy. We've used that as a treatment for over 30 years. More recently, we're starting to look at it in other diseases such as Parkinson's disease. Now, when we say ketogenic diet, we're not really talking about the trendy that you see on TV, reading a magazine, keto-friendly diet. A ketogenic diet, when we're looking at it for medical therapeutic purposes, is about 60% fat, 10 to 15%, or I'm sorry, 30 to 35% protein, and less than 10% carbohydrates. So this is an extremely high fat, extremely low carbohydrate diet. This is not the run-of-the-mill keto diet. This is something that can be only done properly under the guidance of a healthcare practitioner. This is not something that should be done on your own because you are at a high risk of nutrient deficiencies. They have seen in some studies looking at that strict therapeutic ketogenic diet resulting in the production of ketone bodies. And so the production of ketone bodies impacts the body's use of nutrients and energy metabolism, as well as impacts insulin production and insulin sensitivity. Ultimately, we then see changes in the microbiome of the GI tract, so that bacterial environment. And we have seen in some studies that potentially leading to a decrease in symptoms of Parkinson's disease. It may also specifically be helpful, in one study proved, as treatment for improved vocal quality in those who suffer vocal quality issues related to Parkinson's disease. The third item that I put on this slide is omega-3 supplementation. So there is some evidence showing that dietary supplementation of polyunsaturated fatty acids, omega-3s, reduces depression in Parkinson's disease patients. This is important as depressive symptoms are very common in people who have Parkinson's disease, and we often see that accelerating or worsening other symptoms of Parkinson's when combined with depression. Supplementation may play also a role in neuroinflammation and the course of the disease in Parkinson's disease. Now, as a dietitian, I am not one to promote supplementation over real food. So if I were to work with someone, I would not necessarily say, okay, we'll go buy a fish oil supplement. I would rather have you consume that in the form of real foods because you're getting other nutritional benefits from the real food than you are with just a pill supplement. However, your physician or someone that you work with to help treat your Parkinson's may recommend that you start taking a supplement. I would encourage you, though, to look for food sources of that as well. Even if not strictly adhering to the Mediterranean diet, those who do increase their intake of polyunsaturated fatty acids or increase their intake of dietary fiber or antioxidants, we still see some benefits in Parkinson's disease symptoms and progression. So even if you are not able to completely adjust your diet over to a Mediterranean style, any small improvement that gets you towards that diet plan can be beneficial in terms of symptoms. Overall, though, we just need more studies in terms of dietary intervention and how impactful that could be in terms of symptom reduction and overall treatment. So this graphic is looking at the Jackson study that I just talked about, specifically in Mediterranean-style diets versus Western-type diets. And if you look on the left-hand side of the slide, we see someone following a Mediterranean-style diet. And in this, they have a good, healthy digestive microbiome and good, healthy gut lining, so that only appropriate nutrients are getting through that should be. This in turn leads to decreased insulin resistance throughout their system and decreased inflammation. Versus on the right-hand side, we see someone consuming more of a Western-style diet. In this, we see the leaky gut syndrome, where toxins, pathogens, and other things are getting through the digestive lining that we don't want to be. This in turn results in worsened insulin resistance, and it promotes inflammation. This is just a list of resources that I used for this presentation that you could access. Johns Hopkins Medicine, Harvard Health Publishing, the Academy of Nutrition and Dietetics are all good sources to get information in terms of nutrition related to Parkinson's disease. I also listed some of the studies that I cited here in this presentation, which are interesting, and I encourage you to stay up on nutrition research related to Parkinson's disease because it really is new and changing all the time. So for any questions related to what I talked about today, as well as any other nutrition questions you may have related to your Parkinson's management, I have provided my email here. I would love to hear from you and am willing to help you in any way that I possibly can. Thank you.